Hi, I'm Dr. Adame from Marshall County Pediatrics. Some of you sent some questions to Facebook, and I'm here to answer them today. The first question is, my wife and I are on a gluten-free diet. Is it okay for our baby to also eat gluten-free? Well, once a baby starts to eat table foods, I don't recommend a gluten-free or low-carb diet unless, of course, the baby has a documented case of celiac disease, which is an allergy to gluten. Unnecessarily restricting nutrients such as carbohydrates or fats or protein from a child's diet places them at risk for being underweight or for a nutritional deficiency. And low-carb diets are never appropriate for children of any age because the brain's main fuel source is glucose, which is a derivative of carbohydrates. Low carb and even potentially gluten-free diets can deprive a child's developing brain of its main fuel source if these diets aren't done appropriately or for the right reasons. If your baby or child must eat a gluten-free diet because a family member has celiac disease, then make sure to include other sources of healthy carbohydrates such as rice, quinoa, potatoes, or legumes. All right, the next question. The next question is, I am pregnant. How does my baby become a patient at your practice? Well, if your baby's born in Plymouth Hospital, then when your baby's born, all you have to do is tell the nurses that you want either myself, Dr. Adame, or one of my partners, Dr. Shah or Dr. Batra from Marshall County Pediatrics to be your baby's doctor. And one of us will go and see your baby at the hospital, and we'll arrange for your baby to follow up with us at our clinic after discharge. If your baby is born at a different hospital, just call our clinic at Marshall County Pediatrics right before discharge so you can arrange follow-up for your baby after your baby goes home. Make your appointment to see one of us. We reserve slots each day for newborns, so we can see your baby the same day you call in most cases. All right, the next question is, can infants get strep throat? This is a very good question. We get this a lot. It is very rare for children under the age of 2 to get strep throat. And even if they do get it, they don't need to be treated for it. The main reason that we treat for strep throat is to prevent complications from strep, such as rheumatic fever, which is unheard of in children under the age of 2. So the short answer to that question is we usually don't check or treat babies under the age of 2 years for strep. And then the last question is, do I need to keep my child home from school if they have pink eye? That's one of those other million-dollar questions that we get a lot. And the answer I'll give is that depends on your school's policy. Pink eye, very contagious, but it's not dangerous, and it's very easy to treat. However, I do suggest that you follow your child's school or daycare policy regarding pink eye or other infections. Alrighty. Thank you once again for submitting your questions. I had a great time answering them. If you have any other questions about your child, please make an appointment to come and see me at Marshall County Pediatrics. I'm accepting new patients.